Imagine going about your day feeling completely fine, doing everything you normally do, unaware that something dangerous could be developing inside your body, no sharp pain, no obvious warning, no reason to panic, and yet, beneath the surface, your arteries may already be narrowing, quietly restricting blood flow to your heart. This is what makes artery blockages so dangerous. They don't announce themselves, they don't always cause pain, and for many people the very first sign is a life-threatening event like a heart attack or a stroke. Cardiovascular disease remains one of the leading causes of death worldwide, claiming hundreds of thousands of lives every year in the United States alone. What makes this especially alarming is that many of these individuals never realized they were at risk. High cholesterol, high blood pressure, poor circulation, and inflammation can all develop silently over time, slowly damaging the arteries without obvious symptoms. That's why understanding the early warning signs is so critical. Today, we're going to walk through 9 silent warning signs of artery blockages that can appear long before a heart attack occurs. These are signals your body may already be sending, often subtle, often easy to dismiss, but incredibly important to recognize. One of the most well-known but still frequently misunderstood warning signs is chest pain or discomfort. Many people imagine heart-related chest pain as sudden, severe, and crushing, but in reality, it often begins much more subtly. It may feel like pressure, tightness, heaviness, squeezing, or even a burning sensation in the chest. Some people describe it as discomfort rather than pain, which is one reason it's so often ignored. This sensation is commonly caused by a condition known as atherosclerosis. Over time, plaque made up of fat, cholesterol, calcium, and other substances builds up along the inner walls of the arteries. As this plaque hardens, it narrows the arteries and restricts blood flow. When this narrowing affects the coronary arteries, which supply oxygen-rich blood to the heart muscle itself, the heart begins to suffer. The heart is a muscle that relies on a constant supply of oxygen to function properly. When narrowed arteries limit that supply, the heart struggles to keep up, especially during physical activity or emotional stress. This imbalance between oxygen demand and oxygen supply is known as ischemia, and it's what triggers chest discomfort. The sensation may also spread beyond the chest, radiating to the shoulders, arms, neck, jaw, or back, making it even harder to recognize as a heart-related issue. In some cases, plaque within the artery can rupture. When that happens, the body forms a blood clot around the rupture. This clot can partially or completely block the artery, cutting off blood flow to part of the heart muscle. When heart tissue is deprived of oxygen for too long, it begins to die, resulting in a heart attack. This is why chest discomfort should never be dismissed, even if it feels mild or comes and goes. Another reason chest pain is often ignored is because it can be mistaken for indigestion or heartburn. The discomfort may occur after eating or feel similar to acid reflux. However, unlike indigestion, angina usually does not improve with antacids and tends to follow a predictable pattern. It often appears during activity or stress and eases with rest. Recognizing this pattern can be life-saving. Another major warning sign is shortness of breath, also known as dyspnea. Normally when you're active, your heart and lungs work together to deliver more oxygen to your muscles. Your heart pumps faster and stronger, ensuring oxygen-rich blood reaches where it's needed. But, when arteries are narrowed by plaque, this system no longer works efficiently. Restricted blood flow means the heart itself receives less oxygen. To compensate, it works harder, but this added strain makes it less effective. As a result, your muscles and organs don't receive enough oxygen to function properly, leaving you feeling winded even during activities that used to feel easy, like walking short distances or climbing a few stairs. This lack of oxygen doesn't just affect the heart. The brain senses the oxygen shortage and triggers the feeling of breathlessness, urging you to breathe faster. Even though your breathing rate increases, narrowed arteries prevent enough blood from reaching the lungs and heart, so the sensation of air hunger persists. This can make breathing feel labored or unsatisfying. In more advanced cases, shortness of breath may occur even at rest. Some people notice it when lying flat, especially at night, because this position increases pressure on the heart. Waking up gasping for air or needing multiple pillows to sleep comfortably can be a sign that the heart is struggling to supply blood under normal conditions. This symptom is particularly concerning and should always be taken seriously. Persistent fatigue is another silent warning sign that often goes overlooked. This isn't the typical tiredness that improves with rest, it's a deep, lingering exhaustion that makes even simple tasks feel overwhelming. When arteries are narrowed, blood flow throughout the body becomes compromised. Since blood delivers oxygen and nutrients to every cell, restricted circulation means your body is constantly operating at an energy deficit. The heart, already working harder to push blood through narrowed arteries, becomes less efficient. To cope, the body shifts into a conservation mode, prioritizing blood flow to vital organs while reducing supply to muscles and other tissues. This leads to ongoing fatigue, mental fog, and reduced stamina. You may feel drained after minimal activity or find it difficult to maintain your usual routines. Because this fatigue develops gradually, many people attribute it to aging, stress, or just having a busy lifestyle. However, unlike normal tiredness, it doesn't really improve with sleep and often gets worse over time. Chronic fatigue that's linked to artery blockages is actually a sign that the heart and body are under strain and need some attention. Pain or cramping in the legs during activity is another important warning sign. This condition, called claudication, is associated with peripheral artery disease, where the arteries supplying the legs become narrowed or even blocked. When you walk or exercise, your leg muscles need more oxygen. If blood flow is restricted, then the muscles just don't get what they need. This shortage of oxygen causes a buildup of metabolic byproducts like lactic acid, which leads to pain, cramping, or sometimes just a heavy sensation in the legs. The discomfort usually eases with rest, as the muscles' demand for oxygen goes down. But over time, as blockages get worse, the pain may start sooner and become more intense, even during short walks. The location of the pain can offer clues about where the blockage is. Calf pain often points to blockages lower in the leg, while thigh or buttock pain may indicate issues higher up. Peripheral artery disease is not just a localized problem, it's a sign that atherosclerosis is affecting blood vessels throughout the body, including those supplying the heart. Nausea and sudden sweating can also be warning signs of artery blockages, especially when they occur alongside other symptoms. When blood flow to the heart is restricted, the body perceives it as a serious threat and activates the autonomic nervous system. This triggers a fight-or-flight response, releasing stress hormones like adrenaline. These hormones can cause cold sweats, even when you're not hot or physically active. At the same time, blood is redirected away from digestion to support vital organs. This disruption can lead to nausea, as the stomach temporarily receives less blood. Because these symptoms are often associated with anxiety or stomach issues, they're frequently dismissed, but when combined with chest discomfort or shortness of breath, they should never be ignored. Heart palpitations are another sign that something may be wrong. A sensation of your heart racing, pounding, fluttering, or skipping beats can occur when the heart is under strain. Narrowed arteries reduce blood flow to the heart muscle, leading to ischemia. In response, the heart may develop an irregular rhythm, known as an arrhythmia. To compensate for reduced oxygen delivery, the heart may beat faster, attempting to push more blood through restricted arteries. This can create a cycle where stress and adrenaline further increase heart rate, making palpitations more noticeable and harder to control. While occasional palpitations can be harmless, persistent, or severe episodes, especially when paired with other symptoms, may indicate underlying artery blockages. High blood pressure is one of the most significant and dangerous silent warning signs. When arteries narrow, blood has less space to flow, forcing the heart to pump harder. This increased force raises blood pressure and places additional strain on both the heart and the arterial walls. Over time, the heart muscle may thicken, particularly the left ventricle, reducing efficiency and increasing the risk of heart failure. High blood pressure also damages the inner lining of blood vessels, making plaque buildup more likely and accelerating the progression of artery blockages. Because hypertension often causes no noticeable symptoms, many people are unaware they have it until serious damage has already occurred. Swelling in the legs, ankles, or feet, known as edema, can also signal circulation problems. When the heart struggles to pump effectively, blood can pool in the lower extremities. Increased pressure in the blood vessels causes fluid to leak into surrounding tissues, leading to visible swelling. This symptom is especially concerning when it worsens over time or appears alongside fatigue or shortness of breath. Changes in skin color or temperature in the hands or feet can also be a sign of restricted blood flow. Reduced oxygen delivery may cause the skin to appear pale, bluish, or feel unusually cold, even in warm environments. The body prioritizes blood flow to vital organs, leaving the extremities with less circulation. This can be an early sign of peripheral artery disease and widespread atherosclerosis. Recognizing these warning signs is essential for protecting your heart. Each symptom reflects how your body responds to reduced blood flow and oxygen delivery caused by narrowing arteries. Paying attention to these signals and seeking medical advice early can make a significant difference. Early intervention, lifestyle changes, and proper treatment can slow or even reverse the progression of artery disease. Your heart works tirelessly for you every day. Listening to what your body is telling you and taking action when something feels off is one of the most powerful steps you can take toward long-term health. If you notice any of these symptoms, don't ignore them. Talk to a healthcare professional, stay proactive, and take care of your heart.